Hi, I'm Jessica, and here's my client Karen. She is a 9-month-old who was born at 35 weeks gestation. Currently, she gets highly irritable, and at the moment, she does not crawl, and she cries when she's in prone. However, she loves to be rocked and swaddled to sleep. The three pieces of equipment that I would recommend are a very small peanut ball, the wedge, as well as the platform swing. And these are all suitable pieces of equipment for her as she does not suffer from any seizures. Okay. Hello, so for our very first piece of equipment, we have the wedge right here. As you can see, there is an incline right here. So this side is going to be the higher side and this one is the lower side. And because Karen, she's having a difficult time crawling, this would be an appropriate piece of equipment for her to work on her tummy time. And while she's in tummy time, we can work on bimanual coordination, some praxis, maybe even some weight bearing, and just some overall motor planning. We did note that she does get irritable when in prone. So something we can do to help encourage her to get in a prone position from sitting is by getting some of her favorite toys. She loves Old MacDonald, and she also loves being swaddled and rocked. So if we need to take breaks with swaddling and rocking, we can. And we can also use some of her favorite toys. So if Karen's right here, if she's in a sitting position, we can use some of her favorite toys to help motivate her to get in prone. So I could have her reach here. And here we're working on that bimanual coordination as we're using both hands to potentially reach, as well as her motor planning to get up. And while she's here, she can continue to play with more toys while in prone. Those underlying skills, the praxis, the weight bearing, bimanual coordination, those are all important factors to help Karen crawl. We do know that she is able to sit independently, so it sounds like her postural and trunk strength may not be something we might focus on as a priority, since that she's showing some skills for that. In terms of the area around us, we want to make sure that she has a mat all around her, just in case, during this process she's learning and she falls, she has something comfortable and safe to fall on. We also want to make sure that all the toys we're using are appropriate toys. So if she were to put anything in her mouth, she would not choke on it. And the area as well around her, we want to make sure there's nothing sharp and nothing that she can potentially either cut herself or kind of hurt herself on for the area. And in terms of cleanup, because this is something that is going to be on the floor, we want to make sure we put it away. That way, if another client or patient comes in, or even other therapists can come in to use the area, no one will trip on it. And then last but definitely not least, we want to make sure we are either in a sitting position or maybe even if we need to go on our knees for a bit to help the patient through this process as we're on the ground to promote proper body mechanics. A standing position wouldn't work as it can cause us to kind of overstrain our back muscles. Okay, so for our second piece of equipment, this is my peanut ball. It is small enough to fit Karen's 9-month-old self. She is going to use this peanut ball to help support her praxis, her bimanual coordination. Of course, she is going to be in tummy time, so she's helping with that core strength. And she can also do some great weight bearing, as the peanut ball allows me to move her from left and right to promote weight bearing, which is a great skill to do with crawling. So that's why we want to do the peanut ball. In terms of setting it up, I will get the right size peanut ball for her. I want to make sure the area is nice and clear. There's nothing sharp around for her to hit her head. I want to make sure there's mats all around too. As she's still learning, we want to make sure she has a nice environment for her in case she falls and she's nice and safe. That's what our area is going to look like. In terms of utilizing the peanut ball with the activity, this one, just to be extra safe, I'll either have a caregiver or if I have an aide around, help me with this. What I'll do is I'll let Karen know, Karen, we're gonna go on the peanut ball. So I'll slowly bring her up, and either the caregiver or an aide will help assist me with a toy that's motivating for her. As we know, going in prone isn't really one of her favorite things. It kind of gets her irritated. So to prevent that and help engage her, we'll have some of her favorite toys over here, and I'll slowly help her get into a prone position. Her legs are going to be either on the floor or fairly close to make sure she's stable, but I'll be here for extra support, and I can either rock her back and forth, or I can have the caregiver play with some toys as she kind of reaches over, and we'll help her weight shift and do some bimanual coordination. In terms of proper body mechanics, I do want to watch my trunk. I want to be seated, maybe even kneeling on the ground with her to stay nice and close. And I want to make sure that when I'm with her, I have my hands by her to prevent any falling. And then last but not least, I want to make sure that I clean up the peanut ball at the end, because other therapists might be using that area, and we don't want either therapists or kids or any loved ones to fall over the peanut ball. So for our last piece of equipment, here we have the platform swing for Karen. In order to set this up, what we would do is we would carry the swing first, and then we would make sure that our carabiner is facing upwards and hook it onto the steel eyeball. So that's for setup. And prior to setup, we can make sure that our environment is nice and safe. So we would want mats all around, no sharp objects anywhere, and we want to make sure it's nice and clear. That way, in case she falls or anything, she's nice and safe. We are picking this platform swing because it will help her. Well, first of all, it's client-centered because she loves rocking, and we can also do it while she's in prone. So while she's in prone, she's working on tummy time, trunk strength, bilateral coordination, praxis, and even weight bearing. Swinging can be a great motivator for her since she loves it. And another key safety factor is to make sure that we have the swing at an appropriate height. So for Karen, we want to make sure that the swing is just right below the knee to make it nice and safe. So we can help Karen get on by just letting her know, all right, Karen, we're gonna go on the swing. So we'll pick her up, help her out here. And from here, I'll go ahead and put her in prone. Although I know she can get a little irritated, we're gonna go ahead and just slowly start swinging to get her nice and adjusted. And once she's nice and safe, either myself or a caregiver can have bubbles here for her to reach so she can practice again that prone position, weight shifting, bimanual coordination. After that, I can go ahead and stop the swing and let Karen know that, all right, Karen, we're all done. We're gonna come off the swing. So I'll slowly help Karen get to a safe position and slowly carry her off if she needs help. In order to take this swing off, what we're going to do is lift up the swing and then adjust the height to appropriate height, and then slowly take the carabiner off. And while we're doing this, of course, we'll make sure that the child is safely supervised, and we'll go ahead and put the swing away on the wall. But before the video ends, I'd like to share some body mechanics as we're doing this. We want to make sure that we are seated next to her as the swing is going to be low. And if we do reach down and bend, we want to use our larger muscles and squat. Same thing as we're reaching for the top here, we definitely want to carry the swing, and we also need to make sure we're at a good height, so not reaching too high or bending forward. So if needed, we could use a stool to get to the right length. And that is Karen the platform swing.